pleasant morning, everyone. I am Loy McHugh, and today I'll be presenting on the article entitled Adverse Events and Outcomes of Conscious Sedation for Pediatric Patients, Study of an Oral Sedation Regimen. I'll now do an overview of the article. So, firstly, as was stated before, the article is entitled Adverse Events and Outcomes of Conscious Sedation for Pediatric Patients, Study of an Oral Sedation Regimen. The authors of the article are Drs. P. Lee Lata Weedwood and Dr. William Van Jr. The article is cited in the Journal of the American Dental Association, JADA. This journal has an impact factor of 112. Now, impact factors measure the importance of a journal by calculating the number of times selected articles are cited over a number of years. The higher the impact factor, the more highly ranked the journal. So relative to the Nature journal that is based in the United Kingdom, which has an impact factor of 1,159, the JAD journal can be said to be lesser ranked relative to this journal. The article was also published in November 2001. Now, the major topic covered by the article was sedation, and sedation is the use of a drug or a combination of drugs to depress the central nervous system and thus minimize the awareness of the patient to his or her surroundings. Conscious sedation was the specific focus of the article. And conscious sedation is the controlled drug-induced depression of an individual's consciousness to a minimal extent. Conscious sedation also allows the patient to maintain an open airway independently. Furthermore, it facilitates the individual having the capacity to make suitable or appropriate responses to physical or verbal commands. Now, the type of article analyzed was a retrospective cohort study. A retrospective cohort study is an observational study that involves a group of subjects being subjected to an exposure, a medical event, or an intervention, and the outcome of that medical event or exposure or intervention being analyzed. Now, in this study, 195 sedation appointments were performed in 111 pediatric patients between the ages of 24 to 84 months. And this study was conducted over a 5-year period from July 1, 1992 to June 30, 1997. All subjects received the sedative regimen containing chloral hydrate, meperidine, and hydroxyzine palmate, which is abbreviated as CHMH with oxygen saturation. The authors of this article analyzed the subjects' age, their sex, weight, waiting time after administering the sedative, the treatment given, the treatment time, and sedation outcomes, as well as adverse effects experienced by the subjects after receiving the sedative. Now, practitioners are aware that conscious sedation carries risks from the potential side effects of the medications. From time to time or periodically, morbidity and mortality have resulted from pediatric patients receiving conscious sedation. With different studies highlighting such unfortunate events, the safety of sedation regimens for children continues to be probed. The authors of this article thus decided to report on the adverse effects and sedation outcomes for an oral sedation regimen of chloral hydrate, meperidine, hydroxyzine with 100% oxygen or oxygen saturation. Since this sedation regimen is widely discussed in the medical fraternity. So moving on to the key points discussed in the article. So there was a focus on investigating the outcomes of conscious sedation in pediatric dental patients using the oral sedation regimen consisting of chloral hydrate, meperidine, and hydroxyzine palmate. Furthermore, other regimens, including drugs such as diazepam and midazolam, are also used for conscious sedation. Diazepam has an extended period of duration, while midazolam has a rapid onset and faster duration of action. In another study analyzed and evaluated, midazolam was compared with chloral hydrate as sedative agents. Furthermore, other oral sedative regimens used include chloral hydrate, hydroxyzine, and nitric oxide, or 2 doses of chloral hydrate with or without meperidine. So, as is seen in this image, this is an oral solution of chloral hydrate, and chloral hydrate can be used solely as an oral sedation elixir or solution. Now, the CHMH sedation regimen has antiemetic, anxiolytic, which reduce fear and anxiety in patients, as well as analgesic effects that would confer pain relief. The regimen is also preferred to be administered through the oral route. Each component of the CHMH regimen has separate properties. So meperidine is a sedative as well as an analgesic, as well as it has histamine releasing effects. Chloral hydrate has anxiolytic effects, hypnotic effects that would render the patient sleepy, as well as sedative effects that would calm the patient. Hydroxyzine palmate also has antihistamine effects, antiemetic, anxiolytic, sedative, and hypnotic effects. So the antihistamine property of hydroxyzine would counteract the meperidine's histamine releasing effect, as well as the nausea and vomiting caused by meperidine and chloral hydrate, as these drugs are noted at times to cause nausea and vomiting when used. Furthermore, a minimum waiting time of 45 minutes was utilized during the study to observe the regimen take effect. So the waiting time spanned from the time that the drug was administered to the time when the child was seated in the dental chair. Sedation outcomes were categorized as satisfactory, unsatisfactory, and aborted, and these classifications were subjective. However, the findings of this study were in tandem or was in tandem with similar studies conducted in similar age groups and using similar oral sedative elixirs. So satisfactory sedation is defined as the completion of planned care without interruption or difficulty. Unsatisfactory sedation in this case was defined as completion of the care that was planned with difficulty or interruption due to the patient being disruptive or a completion of less care that was planned. And aborted sedation is defined as discontinuing the care resulting from disruptive behavior of the patient with concerns for the safety of the dental team as well as that of the patient. So 141 subjects, or 72% of the subjects, had satisfactory sedation outcomes. 23% of the subjects had unsatisfactory sedation outcomes, and 5% of subjects showed the aborted sedation outcome. There was no statistical difference between the sexes or among the different ages or weights to determine the different sedation outcomes. No significant differences were also noted in the span of the treatment or the quantity of the treatment received between the satisfactory and unsatisfactory sedation outcome groups. Now, 72% of the subjects in this study were treated successfully, and that treatment was completed under conscious sedation. Now, treatment received by patients under conscious sedation in this study entailed extractions, pulp therapy, possibly root canal therapy, and so forth, stainless steel crowns, sealants, preventive care, alloy and resin restorations, and space maintainers. Now, adverse effects were noted in 3% of appointments after the administration of the oral sedation elixir. Patients were expected to be discharged 15 to 30 minutes after procedures ended once their respiratory functions and cardiovascular functions were noted to be within the normal limits. So prolonged sedation, where a child would need to recover after the 30 minutes that was designated, only occurred in 3 instances of the 195 sedations in the study. Vomiting was also seen in 1 instance, and this low number percentage of this occurrence can be ascribed to subjects adhering to preoperative instructions where there should be no ingestion of food or milk 8 hours before the operation. Apnea, which is the absence of breathing, can occur with the depression of the respiratory system. Now, narcotic analgesics such as meperidine can result in depression of the respiratory system, as well as a combination of meperidine with other sedative drugs. So apnea was also only noticed in 1 instance in this study. Now, the saturation of oxygen or oxygen saturation rather speaks to the fraction of oxygen saturated hemoglobin relative to the total hemoglobin that is present in the blood. So if it is below 95, it is considered to be low, right? And that is oxygen desaturation. So oxygen supplementation mitigates the effects of desaturation as an adverse effect. So the instances of this effect were also low, being 1 in the study. Lastly, I'll move to assess the article. Now, unfiltered information was present in the article, meaning that the information was obtained from primary sources and written by a group of authors, and in this case, it was written by 2 authors. Now, as the article is retrospective, it has low quality evidence relative to a randomized control study design, which is shown on an evidence pyramid in the slide following. The article's level of evidence was also found at level 3 in the different levels of evidence in evidence-based medicine. Now, the fact that the article is of low quality means that if further research is conducted, it is likely to have an important impact on the confidence in the estimate of the results of this study and thus possibly change the results of the study. So this is an image of the evidence pyramid that shows different study designs that have increased quality of evidence and reliability as the pyramid is ascended. So the expert opinions would have lesser quality of evidence compared to the cohort studies, and the cohort studies would have lesser quality of evidence compared to the randomized controlled trials and so on. So retrospective cohort studies are observational studies, as was said in the beginning. And with retrospective cohort studies, you follow a large group of people over an extended period of time to see how an exposure or an intervention will affect a certain outcome that is being investigated. So the risk factors of the medical event or the intervention, which was oral sedation, were observed during this study, and you had observation of adverse effects being the risk factors. So examples of adverse effects would be the vomiting and prolonged sedation and so on. Also, a group of pediatric patients were followed over a 5-year period to investigate the sedation outcomes and the adverse effects of oral sedation, as I said before. So, in application to clinical practice, this sedative regimen of chloral hydrate, meperidine, and hydroxyzine palmate can be deemed effective with the occurrence of minimal adverse effects as long as patients adhere to protocols that are designated and stipulated, and as well as the supplementation of oxygen is provided. So this can be applied to clinical practice. Furthermore, there were multiple operators and monitoring assistants in this study. Hence, this would cause a limitation in the study design, causing the possibility of the occurrence of observer bias. So these are my references. Thank you for listening and viewing. And it is now time for questions and answers. Once again, thank you.